So we want to talk about PPPs and their use in health system transformation. And I think, personally speaking, every time we talk about transformation in this region, PPPs are usually at the top of the list of things that governments want to do. And that may be for the purpose of greenfield, for looking at upgrading assets, for bringing capabilities that they're missing when it comes to non-clinical operations and also clinical operations. And from the government side, it's really trying to reap or to seek value where they have no capabilities, where there are missing, as I said before, the capacity in the system as well, and trying to drive for more efficiency. And for the private side, in which we've also worked on or with, they look at this as an opportunity to open up the space for them where they can play, but also looking at more longer-term stable revenue. Now, it sounds like a win-win typically, and everyone goes into a PPP with these rose-tinted glasses thinking it's going to be great. But typically, and I must speak from experience, it's not an easy journey. It's quite challenging, even prior to actually getting anything signed, getting clarity on what you're seeking and how you're going to construct that partnership, but also during the life cycle of a PPP. So today, I want to spend some time with the panelists, and I think we all have different perspectives here on PPPs, to understand why should we continue seeking PPPs, what do they bring to the table, but also how do you address some of those challenges. So I'll start with you, Dr. Mariam. The first question is, I think Abu Dhabi has been, one of the early adopters of PPPs in the region. So how have you used PPPs in a way to build a robust healthcare system?
Assalamu alaikum. It's my pleasure to be here with you today and talk about the public-private partnership. I think PPPs are important when it comes to the UAE goal and agenda and implementing an economy that is based on sustainability, competitiveness, and investment in the innovative and introduction of innovative solutions. The partnerships been there for years now and proven effective. The collaboration between the public and the private, the joining of efforts, joining of funding, the exchange of experience, the investment in technology did prove that it reduced spend, the government spend, reduce the economic risk on the government. It does attract investment, be it national, regional, or foreign investment. But beyond all of that, these partnerships today are critical to move the healthcare into the future with the continuous pressure on the healthcare systems to do more with less, to provide high quality at a lower cost or cost-efficient level. The experience of the private sector comes handy, whereas the knowledge of transferred to the public through these partnerships, and the services are offered at more economical level. On top of all of that, these partnerships today are changing also. And Abu Dhabi is leading in that change. The traditional public-private partnership types are no more needed in Abu Dhabi. We do have a strong infrastructure in Abu Dhabi for the healthcare system itself. We have plenty of hospitals and clinics. We do have strong providers, international providers, as well as national providers who proven that they provide the highest quality of care. So where we need these partnerships today in Abu Dhabi, and as I said, Abu Dhabi is leading in that role. We need to move into the future, and we need to invest more into digital health, into population health, into personalized medicine, and invest around the patient needs. Put the patient in the heart of the healthcare delivery, and PPPs today is a driver for that. We have a lot of successful initiatives and partnerships that today introduce innovative therapies or new technologies in the market in Abu Dhabi.
Yeah, great. And I think that change from the previous era where it was mainly asset building to now more innovation, delivery of services to patients, that's where Abu Dhabi is changing. And how does that mean, what does that mean to you as a regulator? How are you changing your approach to support that?
So it did change. We are not investing in infrastructure anymore. I think as a regulator, we want to uplift the healthcare delivery from a quality, from cost efficiencies, and these partnerships coming with that knowledge. And big partnerships like the pharma coming in, partnering with the providers, educational institutions, the regulators to introduce innovative therapies such as immuno-oncology or personalized medicine, gene therapy. It's all in the market today. Big tech companies coming in and introduce solutions to take the healthcare delivery into the future, build in the IT infrastructure to be able to capitalize on the big data, AI, use of wearable devices, collect all of these data to improve on the population health and the prevention and the health and well-being of the people.
Right. I'll move that on because I think as you start to build those new or advanced ways of thinking of PPPs, sustainability is always an important topic. And Dr. Ibtessam, if you can tell from your experience, as you lead the Department of Health, Dubai Health Authority as the investor lead, how do you drive that sustainability component in your PPP sort of construct and execution?
Okay, first of all, thank you very much for having me this afternoon. Being as a physician, 10 years experience as a physician, and then moving to the management and looking at the business development and commercial side of the project, I need to balance between the patient's clinical outcome and business outcome. So PPP is a tool where basically most of the government is using. It's something not new in the world market because it's been there for many years. When it comes to here, so we did a couple of PPP infrastructure. When you define as a PPP can start with a simple joint ventures or service level agreement for 2 to 3 years contract, and it can goes up to 25 years. It depends how you want to design it. Definitely, before you design your PPP, there is a rule of thumb. I always advise everyone to do it, which is your feasibility study. And your feasibility study should not be based on your want. It should be based on the need of the community and the patients. So don't come and design a project because you like it and you want it. Your VFM and net profit values will actually crash. So always look what is basically the need of the market and build up the feasibility study and work along it. Look at it from the clinical aspect, which is operationals or technicals, if it's an infrastructure center. Look at the technology part of it as well. Look at it from legislation and financials. Once you have these 3 elements working together, indeed, you're going to have a proper feasibility study that you're aiming for to build up a proper PPP to ensure that it is sustainable for the life cycle of the project. And let me give you an example of marriage and divorce, because when you select your partner, you always do kind of like a history background, and you check whether he's a suitable or not, or she's a suitable or not. Similar thing, when you're doing your PPP, you have to select the right way because you're going to stay with it. And it is not just a business model. It's a design, build, operate, financial support, transfer, which a lot of people forget about it. So it's not once you sign the contract, you just sit at your office. It's basically where the work, you need to sharpen your pencils, you need to work on it until the project is transferred, which is like a 25 years of life cycle, or 15 years. It depends how you design your contract.
Yep. The sustainability point is one aspect, and I think it can also fail in some cases where the value extracted is not necessarily always there. In cases where that happens, I mean, how do you adjust, or how do you ensure some continuous assessment through the life cycle of a PPP? What do you deploy today?
Of course, it's basically, when it comes to the PPP, it has its own guideline and standard that you really need to follow. And it's a procurement standards, and you really need to follow, because based on your feasibility study, you need to do a risk assessment. And on the risk assessment, you have to do it at the beginning, during the operations, and as well at the execution levels. So it depends at which level basically you are looking at it. And you have to have the provisions, what kind of a risk you might face, even if there is an outbreak like COVID-19 was one of the risks to our project. Let me give you an example. We in Dubai doing the first infrastructure PPP projects where the consortium is bidding for our CCOE, which is Center of Excellence of Cardiology. So, and the model is quite unique. You don't see it anywhere in the world, because we designed it and we did it just based on our needs and what we're really looking at it. It's a design and build model, but it has a clinical knowledge partner. So we are getting like an expertise who can support our own clinicians for the best outcome. And this is the way it's been done. So on each phase that we were studying it and looking at it from financial aspect, legal aspects, technical aspects, we always had multiple risks, and always we need to have a plan how to mitigate those risks. So whether you are at the pre-phase or during the phase of the project or during the executions. So this is very, very important. And let me give you another example, what's happened to us. While we were doing our project, we discovered that we didn't have a good expertise in medical planning. So, you know, it was honestly kind of like a worrying, and that's because maybe we missed to understand what was going within our operations. So immediately we assigned a team expert on how to do the medical planning for the projects, and taking all those standards and looking at it and putting into our documentation so the bidder can apply for the project itself. So this is the way you really need to do. Now the thing is now, whether you have your own people who has an expert, you always can keep them and you can work with them, or you can always get an external expertise from the advisors or any firms that you are working with. So this is basically the way we have handled it, our projects.
Okay. And obviously it's a very long-term capability that you have to build up within the government as well, because it's something that you need to spend it. If we move a little bit into another sort of area, and Dr. Mariam, you'd mentioned it earlier, the fact that you're using PPPs to drive innovation. If I can ask Dr. Saif, from your experience, why should PPPs be the right means in many cases to drive innovation, digitalization of healthcare systems? What's your experience in that front?
Assalamu alaikum. So we present the private P in this equation, and I think that there is countless projects that we work with the Department of Health with Dr. Mariam and her team, which proves that working with the private sector will accelerate the time needed. And today, when we talk as pure health, time is the essence. Time is important. You don't have this, I would say, luxury of losing time when you want to implement such projects, and especially when it comes to health. Those projects are multi-year, larger scale, huge impact. So the learning curve is a gain when you work with the private sector. You will not go through the process of trials and errors. And then the cost, and especially now when you talk about innovation and the cost of innovation, you don't want to get into an innovation exercise that is either small and becomes super expensive at scale, or it's not scalable. So the two, what comes to my mind, that the two gains you get from those partnerships is you will save on the time and the learning curve, and you will save on the cost and the scalability. And this is what we've seen in those projects that initially were primarily within the government of Abu Dhabi, then we've expanded and we started working at the federal level, and very recently in the region. So coming as the private P is leveraging on what Dr. Ibtessam said. The partner should be also ready to work with the government. Daman may be privileged as one of the few entities that we have a vertical that only works with the government on whether it's PPP or projects or relationships, and leverage what we have. We tap into the resources, the expertise we have as a company, but also as a group. And then when we don't have this level of expertise, whether those would be advisors or innovative companies or even large companies that have delivered such projects at scale in a different country, it's easier for us to reach out to them and try to compare the curve, the learning curve, the cost, and what we can do locally versus what we need to buy. And you bring all of that to work with the government, that gives you sustainability. Unlike commercial projects, anything we do with the government, we know it's multi-year. Anything we do with the government, we know that the government creates the rules, creates the framework, and the enablers for this, even if it requires, and we have many projects that requires a change in the regulatory framework. But that's the beauty where you're working with a partner that can enable the private sector to succeed.
Yeah. I think we've now got a compelling case of why, right? I think there's this clearly, helps the reform, there's the sustainability, and there's the innovation. Now, the sticking point is always executing on this front, right? I think everyone has an understanding of what the potential is, but driving for a true partnership is always a challenge. Dr. Mariam, again, from your side, what's that environment that, as a regulator, that you need to set up to allow for that? And then how does, from your insights, I know Abu Dhabi is probably in the slightly forefront from others, but how does that compare to other regions, and where do they need to go?
Thank you, Jay. So we had a discussion before this panel, and we were talking about how what the level of maturity in our regulation, and Abu Dhabi and the UAE is way ahead of every country in the region when it comes to the legal framework. I believe the UAE regulations are very agile and sensitive to the changing business needs. It's a business friendly, and I believe it's a golden standard for very good reasons. First of all, the regulation are introducing level playing field. Everybody is equal from a regulatory perspective, the same opportunity for investment, same opportunity for ownership, the same regulatory from licensing and other requirements, and the same payment for the service. So that sets everybody at least to the same level for success. The regulations are not ambiguous today, alhamdulillah. They are very clear and very accessible for everyone. Our regulation does support attraction and retention of talent and open doors for the partnership and for the private sector to innovate. And I'll use an example that we have today in Department of Health, where we are introducing a framework for the health technology and evaluation, assessment and evaluation. And that's the door for introduction every new therapy, be it medical or non-medical or device into the service delivery, making sure it's appropriate, it does cover a need, and it's paid for any provider or investor to invest in that service. I wouldn't be a good panelist if I don't bring up COVID. So let me bring COVID into the discussion. And a very good lesson learned from COVID is that the ease up of regulation did actually allow for research breakthrough and innovation in the field. And that's a lesson that we are continuing to implement going forward. And I think the role of the regulator in the future will change. It won't be the government traffic cop, but it will be more of a body that introduces standards for the service delivery or the business exchange, a body that influences the policies to catalyze for the future health and innovation, a body that protects the best interest and the safety of the consumer and the patient.
And maybe we take the other side of the coin, which is the private side, and I'll ask Dr. Saif to talk about, maybe, and taking your analogy as a marriage. So how do you maintain or sustain a marriage? Daman was put in place, I think, 15 years ago. It's been there. I'm sure it's had its ups and downs. What are the things that you think need to be taken into account as a private player in a PPP model that helps to, sustain it and flourish? You spoke about, extending beyond borders now as well.
Yeah, well, interestingly, so Daman is a PPP, but at a point we were the public in the PPP, and I think back to what Ibtessam said, there was clarity on what the government wanted. They wanted to create a payer and to save on the cost, on the time, on the learning curve. They chose the partner, and the partner was a global player who've done this job at scale in multiple countries. And we had a journey where there was a build, there was an operate phase, and then there was a transfer, and when Daman became a completely owned entity by the government, and then now by Pure Health. And apart from that learning curve, the pass of knowledge, but it's also the mission that today we are the private P, when we talk to other governments in the region. We have set up in a neighboring country that we work with the government, leveraging the learning curve, the localization that we get from the experience of how can we now build faster PPPs and transfer the knowledge to, let's say, to the public partner and help them. But it all goes back to identifying the need, as you called it, Ibtessam. It's super important that why you are doing this PPP, what you expect from the PPP itself, regardless the choice of the partner, regardless if you will have your own people or you will use a third party to bridge the gap. But a lot of it is what we need today is to bring the knowledge and localize the knowledge and make sure that there is a clear path of this knowledge transfer, whether it's a 5 years, it's a 10 years, or it's a crystal clear KPIs, like what do you want to achieve?
Yeah, and you spoke about, earlier on we had a discussion, you said that the makeup of the team as well is important, right? It's not thinking as a private player, not just a short term, I'm in for the short term transaction, but thinking about how do I establish the right team in place that is longer term, maybe local as well. I don't know if you want to speak a little bit about that as well.
Absolutely. I mean, if you think about it, many of those set of expertise, like let's say in healthcare, was scarcity in the GCC. So a 15 years old PPP is different than a PPP you do today. Today, if there is a lack of expertise in certain area, for example, when it comes to insurance and the actuarial science, so we don't have to wait for another 15 years to make sure that there are those set of expertise so we can pass the knowledge. We should use the innovation. We should make sure that there is local talents that will take over, and if it's not, then start building them from day one.
Great, thank you. I think we'll open up for any questions in the audience, if there are any questions on PPPs and maybe even your experience, good or bad. Great to hear from you.
Good afternoon, ladies and gentlemen. My name is Sophie Smith. I'm the founder and CEO of Nabda Health. We are a UAE headquartered holistic and hybrid healthcare company for women, focused on the detection, diagnosis and treatment of chronic disease. We were originally registered in the Sharjah Research Technology Innovation Park. We recently acquired our first clinic in Dubai, and we're now looking at establishing a presence in Abu Dhabi. For a locally registered company like ours, the requirement to be registered in every emirate is both cost and time prohibitive. How far away are we from seeing pan-emirate, nationwide public-private partnerships?
Thank you for that. I would leave it probably to Dr. Mariam or yeah, either one of you.
Need to have that as soon as possible. We've seen progress on different levels of bringing up the regulation to a national level and standardization of regulation. I think it's coming, and I think it's coming soon.
Hello, hi. My question is to Dr. Ibtessam. You talk about the risk. So I know I had work in US working in private and public funding. So tell me about the consequences of risk are different to deal in private and public sector. How it will be different?
The reason behind why you really need to look at the risk of any project, it's very crucial, because you need to predict things before it's happened. Now, during our even feasibility study, or before we go into procurement phase, we had COVID-19, but we didn't stop the project. We kept it going on. I mean, we got a bless from His Highness Sheikh Maktoum bin Mohammed bin Rashid Al Maktoum, and we went ahead and we started engaging. It's very important to have the expertise with you and to study the matter or the projects very well, identify your risk, and always have a plan how to mitigate it. For example, I give you the example of medical planner. Now, similarly, risk in terms of the financial, there should be an agreement between both, public and the private sector. I mean, you can't throw all the risk always on the private sector. Governments needs to take the commitment as well. And that's why what I said, it's design, build, operate, finance, transfer. So it's a 25 years life cycle or 15 years life cycle. So there is a commitment from the government as well. Because what if the private sector collapse? So who will continue the project? You don't know what's going to happen in this 20 years. So always there should be a security coming from the government, and that's why it's a public-private partnership. Somebody needs to help the others, and it's actually a support from both, and that's why I brought the marriage example. So if one had fallen down, the other can actually pull it up. So that's the kind of a balance you really need between public and private sector. I hope I answer your question.
Great. I think we're out of time. So I would like to thank the panelists for sharing their experience on PPPs, and thank you for listening.